so good morning. Today we are doing a COVID panel discussion sponsored by our hospitals, Baylor Orthopedic and Spine, Methodist Mansfield Medical Center, and Medical City of Arlington. And so we're going to start off by the hospitals kind of give us some updates as to where we are, what things look like in their hospitals. So Matt, I'm going to let you kind of start off with that, and then we'll just have a general discussion with our doctors. And so you guys, if you'll just kind of introduce yourself, and then we'll go and introduce our doctors, and then we'll start our discussion. But let's kick it off with an update.
Okay. Matt Staley with Medical City Arlington. Status update for us is we were sitting around 4 patients in the hospital with COVID for about two to 3 months. And then a few weeks ago, saw this was a really steep spike. We went to about 40 cases over the weekend, and it's continued to climb. We're sitting at about 80 cases in the hospital right now. We've got about 10 that are on vents, and that's been fairly consistent for the past week and a half, where we've been sitting around that 70 to 80 mark. The bulk of those that we're seeing, the higher severity cases, are those who are unvaccinated. Those are the ones that we're seeing mainly in the ICU beds, on the vents. The ones that we've been seeing that are vaccinated are fewer, and the cases don't seem to be quite as severe for those. But that's the status update as far as where we are with Medical City.
Okay.
Good morning. I'm Juan Frescas with Methodist Mansfield Medical Center, and as Matt, we are seeing a significant surge in the past month. Currently, we have over 100 positive patients in the hospital with a capacity of 246 beds for adults. That's a significant increase. So we're just under half of our census is filled with COVID patients. About 10% of those, a little more than 10%, are in the ICU critical care, with about 13 so that's very typical to what we were seeing in the prior surge. But we had actually gotten down to a COVID positive census of 5 during the lull. But with the lifting mask in the community, and as we started to now get toward the end, and we'll let the physicians talk about the vaccination effectiveness over time, we're starting now to see cases rebound. Over 95% of the patients in the hospital that are positive are unvaccinated. So that's still showing significant impact with the new variant, and it's infectious. I guess the infectiousness of it is really driving this increase in positive cases. Or also, if you look at the ages of the patients, they're lower than what we were seeing in the prior surge. So whereas before they were more senior, in the senior category, we're actually seeing a lot of young adults that are being hospitalized now. So it is alarming. It's very alarming for us in the healthcare industry, knowing that we're approaching flu season, and that's going to, coupled with the infectious nature of this COVID virus, is really concerning us greatly, because I think most all the hospitals now are at capacity and holding patients because we just don't have hospital beds to put them in. So they're waiting in the ER for beds to become available. A big concern for us, especially again coming into flu season. So we're having to be very creative in kind of where we put patients. Patients that would have previously been admitted we're now having to think hard about discharging and having home care for. I had a patient today that we came in this morning with the cellulitis that would likely have just had IV antibiotics and been admitted. And we're now having to try to coordinate, have that done at home. because we just need the beds. So it's unfortunate that we're at that point, but it's necessary so that we can provide care to the community.
Okay, so I'm gonna let our doctors introduce themselves, and I'm just gonna have each of you answer a question for me. If you could kind of give me your, where you are in this, at this time, what it is that you're seeing, the things that are making an impact on you that you would like to share with our listeners here and viewers. And I'm gonna go ahead and start at the end of the table there.
Hi, good morning. I'm Dr. Jessica Barker. I'm an OBGYN at Medical City, Arlington. I am in a private practice with Matlock OBGYN. And what we're seeing is we're seeing an increase in cases in pregnant women. Women's hospital, where we have our antepartum, postpartum, and our labor and delivery unit, we are seeing an increase in COVID cases in those patients. We are encouraging our patient population to get vaccinated, and in their third trimester, as much as they possibly can, quarantine at home with just their close circle, because they are a high-risk group, and we want them to contact with the population if they can avoid coming into contact with asymptomatic positive COVID individuals, and even symptomatic ones. Obviously, we're hoping for that. So we are really pushing. Our MFMs are really encouraging women to get vaccinated in pregnancy. It's been found to be safe. There's no side effects or fertility issues that we found with the vaccine. So we're really hoping that they hear us and heed that.
Okay.
I'm Dr. Shantala Samart. I'm the Director of Infection Prevention at Methodist Mansfield Hospital, and also in private practice in infectious disease in Mansfield with ID partners. So it is quite concerning, like I was alluding to. The majority of patients in the hospital right now are unvaccinated. They're also younger than what we've been used to seeing with our last surge. There's also some shortages, periodic medications that we use to treat our severely ill patients, and that's a nationwide shortage. Put all of those things together, it is a very concerning situation. My partners and I see the majority of COVID patients in the hospital, and it is a serious problem right now. The projections say that this could get worse by the end of September and the beginning of October. We will probably be at the numbers that we were seeing in December and January, which was the height of the pandemic in our area. So put all that together, the message is get vaccinated. It is not too late. It's widely available in our and we can talk more about risks and benefits.
So hi, good morning. I'm Dr. Nancy Georgkutty, and I'm one of the primary care doctors in Mansfield. So I've been practicing in Mansfield with the Methodist system for approximately 12 years. So I've never seen a virus like this. And I will say that, being out in the community, I get a lot of sort of firsthand experience where the patient gets to the hospital. So I have patients calling me all the time. So came October, November, December, it was mostly older patients that I was seeing in the office or testing. Now I'm starting to see a lot of young people being affected by the virus, especially kids when camps opened up during the summertime, and especially their parents. A lot of those patients and actually testing those patients and coming back with a lot of positives. I'm starting to see in the last 2 weeks a lot of vaccinated patients coming down with symptoms of COVID and testing for COVID, but I can say those who are vaccinated have less symptoms than those who are unvaccinated. The other thing I am trying to do in the community also, which Methodist has kind of helped us to sort of collaborate, is monoclonal infusions. So in the last 2 to 3 weeks, I've probably sent at least 10 to 15 people for infusions, and that's helped tremendously. And as of Tuesday, the Methodist Health System has increased slots to at least 10 people per day to increase infusions. So I think that's a huge benefit, collaborating with the community providers to be able to sort of provide that service to the community and to be able to kind of help with this pandemic that's going on right now.
Okay, so I'm going to throw out, and one of the things that you had mentioned, the risk and the benefits. I know that I hear a lot of different things. One of the things that I think initially was the fear of the vaccine, that something that would be created so fast, that's got to be dangerous, you know, that if I get this vaccine, I'm going to tell in 10 years. So that's kind of some of the, there's that perspective on why people are not doing it. They're afraid of it. But talk about that. I mean, what about this vaccine?
So the Pfizer and the Moderna vaccines are mRNA vaccines, and the research for mRNA vaccines has been ongoing since the 90s for various other viruses. So it was quite easy to adapt that research for the COVID virus. So it is actually not new research and information. The trials that were done for Pfizer and Moderna last year showed remarkable safety as well as efficacy. And those patients who received the vaccine are tracked over time, and serious adverse events, which is worry about, have been minimal. And the adverse events in the placebo group, which were the ones who didn't get the vaccine, and the vaccine group were actually comparable. And so given that, it's a very safe group of vaccines. Similarly with Johnson & Johnson, the data for that type of vaccine has also been available, and we use it in different viruses already. The efficacy of that vaccine is a little lower than the mRNA vaccines, but the safety data is still extremely good.
Okay, anybody else have a comment on that?
I mean, I've noticed in the community the exact same thing what Smart said, that, you know, the mRNA vaccines tend to hold their sort of immunity longer than the Janssen vaccines. But all 3 vaccines are safe and have no side effects from what I've seen in the community. And what patients actually tell me after they get the vaccine, they sort of tell me what side effects they're having, or they use the, it's the VRAS, which is the vaccine sort of tracking monitor system. The side effects that they have are just minimal. And I mean, so far I haven't seen any major side effects, which is great.
Okay.
Oh,
I'm sorry, go
I
ahead.
was just gonna say, I think from the population, they're worried that getting this vaccine is going to do something to baby or harm baby in some way. And I have to remind them that that's not how vaccines work. When you get this vaccine, you are creating immunity, and you're giving your immunity to the child, as opposed to it getting directly to baby. So for instance, it's just like when you get your Tdap vaccine or your flu vaccine, you're making antibodies to non-replicating, non-virus particles, so that when you see it later, your body's going to know what to do. And the other thing is, the pregnant women that I have seen that have gotten vaccinated, as Dr. Cuddy said, minimal side effects. They might feel have a little bit of a stuffy nose or a low grade temp, maybe a little achy for a few hours a day or so, but nothing that's permanent or the reactogenicity of the vaccines is really, that I've seen in our community, has been low.
Okay.
I think it's also important to note when we're talking about the efficacy of the vaccine, I think the trust of the medical staff. When we rolled the vaccine out or made it available for the medical staff, in the first week, over 90% of our medical staff got the vaccine. At this point in this health system, I think we're at the high 98% percent of medical staff that have been vaccinated. And there's always going to be a few that have conditions that would prevent them from some type of vaccine. But 98% plus of the medical staff are vaccinated. I think that says a lot for the skill set and knowledge base that the medical staff have and the trust that they have in the vaccine.
Well, I find it interesting because it's unfortunate, but it's been politicized. And I think that has more of an impact on people's beliefs and how they perceive and view things. But for me, from you, you live with it, you see it day in and day out. To me, that's reality, no matter what I hear or see from somewhere else. And it's interesting, you can always go to the internet and find somebody who can back up what it is. But for me, the proof is kind of in what happens and what you guys see and what you're dealing with. And when you look at, let's talk about the difference between, someone who's been vaccinated and hasn't, and what the outcomes are. And also, if you can speak to the long-term effects that people experience even after they're past the stage. So whoever wants to pick that ball up.
Well, and we've kind of mentioned it a little bit before, Juan and I, as far as what we're seeing in the hospitals as the difference between vaccinated individuals in there. Again, our census is mainly consisting of those who are unvaccinated, and specifically in the ICU, they are unvaccinated. We don't have a vaccinated individual with COVID in the ICUs at this point or on vents. And so we're definitely seeing a very stark difference in the severity of the case, depending on the patient being vaccinated or unvaccinated coming in there.
That's a great point that Matt brings up. I think it's important to also note at Methodist Mansfield, 100% of the patients in the ICU that are COVID positive on vents are unvaccinated, that not have vaccine. So that says a lot.
That's also what we're seeing in the pregnant population. The women that are being admitted to the hospital, they're unvaccinated. Whereas my vaccinated pregnant population, they seem to be doing well. To my knowledge, at this time, no one's tested positive, but the ones in the hospital are unvaccinated. So in my practice, I've sort of done a comparison in listening to patient symptoms. Those who are vaccinated, I've noticed just come down with headaches, body aches, and congestion. Typically not a fever, and if it is, it's low grade temp, 99, never passes, usually 100. So vaccinated, I've noticed that within 3 to 4 days, they've already come down with a fever of usually over 100, usually coughing, headaches, congestion, body aches. And so they come down with the symptoms and they're sort of progressing faster. I've even talked to patients on the phone and they're already coughing by like day 3, day 4 after exposure, which in October and November, I was only seeing that 7 days when their symptoms were kind of starting to come about or they were testing positive. So they are testing positive faster, what I'm seeing in the community, versus the vaccinated are actually doing well within 5 to 7 symptoms have resolved. And my older population who are vaccinated, who do come down with COVID, I try my best to try to get them the monoclonal infusion as quick as possible, just if they have other comorbidities like diabetes or asthma or COPD, then potentially even having the vaccine and then getting COVID, potentially the Delta strain, they might develop more symptoms because of their age and other comorbidities in the background. And what I've noticed, as soon as they get the monoclonal infusion, within 48 to 72 hours, they're usually doing better. And so I've kind of looked at it on both ends. And so what I've noticed in the community is just the unvaccinated are just getting sicker faster and staying sicker longer and much more severe. And unfortunately, with the kids who cannot get vaccinated, since it's 12 and above right now for Pfizer, The kids are getting pretty sick with high temperatures of like 103, really bad sore throats, really bad congestion, staying sick at home. And luckily, if the parents are vaccinated, which is awesome, they're able to care for their kids. It's hard if it's a whole family that's unvaccinated. It makes it difficult to care for your kids and then care for yourself at the same time. So that's also something I feel like the community to know that, if your kids come down with COVID, you have to be there to be able to take care of your kids. If you're vaccinated, at least you're going to have a milder illness, so you could be able to take care of your children. So that's something I want to be able to sort of share.
So as to what Dr. Cuddy was talking about, she's describing the characteristics of Delta, which is, you can get sicker faster, you can get sicker, period, and you can probably spread it more people than you could with the previous variants. And I saw data in MMWR yesterday that says that people who were vaccinated versus unvaccinated and what Delta can do. So we're unvaccinated are 5 times more likely to get Delta and 29 times more likely to be hospitalized. And
There you go.
yes, so that's some very serious data.
The other thing I want to talk about, or kind of have you guys talk about, is the fact that I think a lot of people think in their mind that it's gone or it's going to go away. From everything that I've read, which could be false, because it was probably on the internet, that this is something that will just continue to be here, that it will not go away. It will mutate, change, but we'll be living with this just like we live with the flu. Is that correct? Or
I think that's fair.
you do?
Yeah.
Okay. And if that's the case, so if this is our reality, our new reality, we move forward in that new reality.
I think that's hard to conceptualize right now for a lot of people. I mean,
It is.
Can anybody imagine wearing masks indefinitely? So I think it's going to have to be something that we take and we tackle as it goes. There's not any definitive, I mean, the medical community, we don't have any definitive what it's going to look like in 10 years.
Right.
We're still going with everyone else, trying to make the best decisions and give the best recommendations to our patients that we can. So I hope we can come up with some semi of this is, what life will look like, but I don't think that anyone has that answer yet.
So I've got a question, it's probably a question for Dr. Samart, because it's a follow-up to the question related to differences between the flus and COVID. It's always been my understanding that COVID or at least COVID-19 and its variants would likely be receptive, or at least the vaccine would be more effective for COVID. But the flu, there's so many different types of flu. They're not all the same, and that's why I think a lot of, from my perspective, the vaccines sometimes hit and miss from the CDC. Could you comment a little bit on the differences?
So with the flu vaccine, you're correct. Because of the rapid mutation and antigenic shifting of the flu virus, we produce the flu vaccine in response to what Australia is seeing in their flu season, which is our flu season. And so our best guess is based on what we see there. And we manufacture our vaccine, which takes a few months. And by the time it's ready to be distributed, we have a better idea of what is actually circulating in our. Sometimes, like you said, it's a good match, and sometimes it's not the best match. With COVID, because of the rapidly mutating and evolving new variants, it's very hard to predict what will work well, what won't. We do know that the mRNA vaccines do lose some of their efficacy against Delta. It appears to be in the area of 66%. at preventing infection. However, it's still doing a great job. Those vaccines are doing a great job of preventing hospitalizations and deaths. And so this is.
So are you saying as new variants come out, there's the potential that they'll have to create new vaccines just similar to the flu then?
Or
Is
modify
that-
existing vaccines? Yes.
Okay. So what, that's the vaccine. What are the other things that are gonna need to be done? I mean, are we talking about the things that we did back in March where it's the distancing, it's the, I mean, all of that stuff that we go, I mean, is that life?
I think nobody wants to sort of.
Nobody wants to say, I
Nobody
know.
wants to hear that.
And nobody
I think,
wants to hear it, yeah.
Because I mean, unfortunately, that's the fear, right?
Yes.
And so I think that creates more worry and more fear. And so the internet already does a great job of doing that. The politicians do a great job of doing that. So I think even for me, being in the community and stuff, I think wearing masks is important just because even now with strep, flu, RSV, COVID, everything, all the different viruses that are out there now that are coming about, and I'm seeing a lot of strep and RSV in the office too. I think wearing a mask is going to protect you from all of that. It's going to be able to sort of help our communities be able to sort of get back to some sort of normal. I think taking a vaccine absolutely will sort of reduce some of the burden on the hospital system, the health system, the physician, the providers in general, the nurses, the staffing. I think that in general is something for the long run to be able to sort of help the future. So I think those are some of the steps that we can take, at least for the time being.
So I was going to say, we've got a perfect group of physicians here to speak to one of the things that's on my mind. When we look at the data for those, for that population that's unvaccinated, many of them are young women that are in childbearing ages that have concerns. So being able to have an obstetrician gynecologist speak to that is going to be important. Pediatrics, we're hearing and seeing a lot of parents that are resistant. So I would say, what message do each of you have as specialists in your areas to send out to those unvaccinated community members that are on the fence about getting vaccinated? And I'd really like to hear from each of you on that.
Well, I mean, I kind of plays to what we've all been saying, you know, COVID is here. And there's not an end in sight at this point. So, and as we've all already said, it's attacking the young, healthy population. Still getting the population, the older population, the population that have several medical comorbidities, asthma, hypertension, diabetes, but unfortunately, kids are being affected and young parents are being affected severely so. So I think anything that we can do to help protect our children, because with, as you two already mentioned, with the bed shortage, you know, things happening, if someone needs to be seen or treated, we're at a tough spot to have to triage what child gets admitted if you've been in a car accident versus you have COVID. That's a really tough call for. So anything that parents, family members can do to what's known as cocoon their group, their social group, get the vaccine, social distance, hand hygiene. For those breastfeeding moms, breast hygiene. It's really important to stress those what seem to be simple things that can help the community as a whole.
I'm going to defer the kids' question to Dr. Cuddy since I'm an adult physician. However, I will say that, you know, as a physician mom, I do plan on vaccinating my kiddos when available for their age group. And I will continue to have my family and make recommendations to the public to mask when you're in indoor places, whether or not you've been vaccinated, hand hygiene, and, avoid big indoor crowds if possible.
I'll sort of reiterate, Dr. Smart and Dr. Doctor's sort of opinions and concerns. Like what I said earlier, that, to be able to sort of take care of your loved ones, your kids, your parents, your grandparents, great-grandparents, I think all of the things that were mentioned, I mean, getting a vaccine, putting on a mask, doing hand hygiene, I think all of those things are just important in just sort of building up the community. And I think that's really the most important thing that people have to sort of consider. It's building up the community and building up and being able to care for your loved ones and people in general. I think people have kind of lost that in all of the pandemic. In our office, a lot of people are stressed or angry, but I think people have to step back and look at, what are we trying to do? We're trying to get the community back to a normal state, and we're trying to protect our loved ones. At the same token, we're also trying to be able to sort of help the people that are trying to help you, the health systems, the providers, like I said earlier. And that's from all genres, from nurses all the way to everybody in the hospital and in the community, being able to sort of support all the people that are sick right now. So I think it takes a group effort to be able to do that. And like I reiterated before, I think for our kids who can't be vaccinated, and I reiterate the same thing as Dr. Smart said, I mean, once my child gets to get vaccinated, I definitely vaccinate her. Just because, I think when parents are vaccinated, and like I said, kids can't get vaccinated, kids under the age of 12 can't get vaccinated, you have to be there to be able to take care of those kids. Or if you have grandparents or parents that are living with you who potentially get sick, you want to be able to be there to be able to take care of them. And I think that's true.
I'd like to piggyback off of what Dr. Cuddy said, also physician mom. So my kiddos, I have a 6-year-old and 11-month-old. And I think too, if we can teach the kiddos to, keep your mask on, try to avoid touching your face, wash your hands when you're around your younger siblings, even the older kids. If you were able to get vaccinated, if your parents allowed for that, which hopefully they are, you guys, hand hygiene is going to be so important. Do what you can, as Dr. Cuddy was saying, to protect your neighbor. If you're keeping yourself healthy and safe, you're going to help keep your community healthy and safe. So especially for the kids that can't get vaccinated yet, help us protect them.
Okay, well, I think that's a good ending right there with what you guys said. Do you two have to say before we sign off here? Any final words?
I think it says a lot.
Yeah.
That our physicians are here, experts in their fields, at all wearing masks. The message is strong that mask wearing is still important, and I want to, like I said, I want to try to reinforce in the community before we get to flu season, how much it's going to help us in the hospital if we flu spread down, so we're not dealing with that as well as COVID spread.
Yeah.
And I want to thank the panelists and thank our physicians for all that they're doing in the community to help our patients, and all that they're doing for the staff in the hospitals. It means a lot.
I would say that. I really appreciate everything that physicians are doing. I work with physicians all day long, every day, and I'm very impressed with the capabilities and the competence with which you're treating the patients and taking care of the population. And I'm of the mind, if you've got questions regarding this COVID, regarding what you should do as an individual, go talk to your physician. Don't go straight to the internet and think that it's
Don't go
got
to
all
your
the
Facebook
answers.
group.
because there's going to be a huge
Yes,
of what you're gonna find.
I know.
If you really want to get to the heart of it, these physicians have been working on this for almost 2 years now. They've got a pretty good handle on what's going on, how to work with it, what's effective. And I would highly recommend that over Googling,
Yeah.
whatever.
I agree with you 100%. I mean, it's like, who cares what the guy at 7-Eleven says? It's what your medical community are dealing with it, seeing with it day in and day out. Thank you all very much. I appreciate it. Thank you for your time, and we are out.